Hi everybody, this is Hanif Azim. I will be your trainer today for ECW E-Clinical Works return patient scheduling. We're going to learn how to make appointments for patients who have been to the clinic before who are already in our system. So let's go ahead and get started. Now the first thing that we're going to want to do is to make sure that we go ahead and open up the program ECW E-Clinical Works. Once you click on that icon on your desktop and log in using your credentials, you will see that it pulls up your gray screen. And we want to make sure we have our resource schedule opened up. That's the part that has the calendar with the My Providers under it and My Resources is under that. So if that's not already open when you open up your ECW, you will want to make sure you go up into the top left-hand corner, click on the menu, click on Practice, and click on Resource Schedule. Now that we have our resource schedule open, we can also select the correct clinic location that this patient wants to be seen at. So you'll obviously ask them which location they want to go to. Click up on the facilities drop down at the top of the page and then select the location that this particular patient needs. In this case, you'll see that I have Sheepshead Bay for Vanguard selected. Once we've selected our clinic location, we can now go up to the top left where our calendar is, select the day of the week and month that we are looking for. Once we select that day, then we can go down under My Providers At and select the name of the provider whose schedule we want to see. If you're going to be looking at several different providers at the same time, you can click on more than one person, but for now we're just going to look at one particular provider's schedule. So as you see, I have Oksana Romanov selected here. When I selected Oksana, it popped up her schedule for that day, so I can see all of her different slots on her schedule for that particular day of the week. Now notice that she has these yellow slots and then also these darker purple grayish colored slots as well. There is a difference between the two, and you'll see the yellow ones say that they are for new patients and the grayish purple ones are for follow-up patients. Since we are scheduling a returning patient in this training, we want to make sure that we are using the follow-up slot and not the new patient slots here. So what you'll do is you'll go ahead and select the time frame that you want that's open and then just double click on that slot to start the scheduling process. Once you've double clicked on the slot, it will open up the appointment window. And on this screen, the first thing that we're going to do is enter the reason for the appointment off on the right hand side. The next item that we want to input is going to be the visit type. So right to the left of the reason for the appointment, you'll see with a red star it says visit type. Now this, if you click on the drop down, there will be several options that you can use depending on what the patient's coming in for. So if it's an Accutane appointment, you could select Accutane. If it's a new patient, return patient, follow-up, whatever the case may be, you can find all those different types here. For now, since this is a returning patient, we're just going to leave it with follow-up. You don't always have to change it, but you can if necessary. So once we have our reason and the visit type selected, now we need to select our returning patient and put their information in here. If you look at the top of the screen, there is the icon for the patient lookup. We're going to go ahead and click on that icon for patient lookup now. Now that we have the patient lookup box pulled up, we're going to go ahead and start off by searching for our patient using their date of birth as the first identifier. In this area, you do not need to put in the slashes, just put in the numbers with the 2-digit day, 2-digit month, 4-digit year. After that, we will put in the last name and first name for our secondary identifier. Now, you don't need to put in the whole name at once. I would suggest that you start with the first 3 letters of the last name, as I did in this example, and that way you won't pull up too little information. The more you put in there, the more it's going to narrow down and can make it difficult to find who you're looking for. So I suggest starting with just the first 3 letters of the last name and then selecting from the bottom and then adding more letters as necessary. Once you have that, go ahead and select that person. You can click on their name and hit select at the bottom right hand. Upon clicking on the patient's name, The first thing that's going to pop up is this alerts box. Once that pops up, check the billing alerts section to see if there are any notes that may be relevant to what you're doing. If there are none, go ahead and click OK. After closing out the alerts screen, we're now going to go ahead and click on the info button at the top of this screen to get to the patient's information and demographics. Now that we are on the patient information screen, there are several items that we need to verify. All the information should be here already, but we're going to update as necessary. So if you look at the address, the cell phone number and phone number, we need to make sure that both of those are still correct. So we will ask the patient about those two. The next thing we're going to do is we're going to verify that their insurance is still active and in force and that they're eligible to be seen here. So we're going to click on the insurance and then click on the IE button towards the bottom. That IE button stands for insurance eligibility, and that would allow us to run their insurance. Once we press the IE button, it's going to pull up their insurance page and will give you an option to click on the refresh button. You will click refresh, and that will bring you to this screen where it has their insurance listed, and it has on the far left hand side all of the subheadings should be in that blue color that will verify that it is in force and active. If any of them show up as red or another color, that means that that particular one needs to be checked and look at the reject reason code to talk with the patient and find out what exactly needs to be fixed and to update that so that you can rerun the insurance and get the all blue result. At the end of the day, if you're unable to run it but the patient is insistent that the insurance is active and in force, please remind them that as long as the insurance is active at the time of their appointment, they'll be fine. If it turns out that it is not, they will be considered self-pay at the time of the appointment and will need to make sure that they have funds to pay for their care in full at the time of the visit. Now that we have run the insurance, look at the bottom left-hand corner of your screen. You will see the additional information button is there. We're going to go ahead and click on additional information because that is where we are going to go over our COVID questions. Now that we're on the patient additional information screen, we're going to click the first three check boxes under the structured questions for those first three questions. Even though we're clicking all three of them, we're only going to really ask the second two. And those are the COVID questions. Okay, so ask those questions and answer them accordingly. Once you've done that, you can go ahead and hit the OK button at the bottom of your screen. This brings us back to the patient information screen. Let's go ahead and just click OK again at the bottom right. Now we are back at our appointment screen. We have all the information entered that we need. So we're going to wrap this up by going ahead and going over all the information with the patient for confirmation to make sure that we have everything correct. I normally like to start at the top of the screen and work my way down. So in this case, I'd say something like, okay, Mrs. Test, looks like I have you scheduled at our Sheepshead Bay location. We're going to be seeing provider Oksana Romanoff on February the 28th at 9:15 in the morning. Looks like you're coming in for a follow-up on a 3-month follow-up for your rash on your hand. Is that correct? And then once you have all that verified, then just hit the OK button on the bottom right. Once you hit the OK button on that appointment screen, it's going to bring you back here to the resource schedule. And you can see the appointment that we scheduled for June test right here at the 9:15 slot. And notice it has changed colors and her information is in there instead of just the information of the type of appointment that can go there now. All right, great job. Thank you for hanging out with me here to go over this training. If you have any questions, feel free to reach out to your trainer. You can also reach out to me for assistance as well. Thank you.